Welcome to the Self-Care for Heart Disease and Better Health program. This is a self-management plan that will assist you to achieve better health and show you the steps to achieve your optimum health outcome. We hope you'll embark on this journey with enthusiasm and ultimately enjoy the rewards. Self-management is defined as a constant process of behavioural choices and decision-making which can be achieved by changing knowledge, skills and attitudes and initiating behaviour change. Quite simply, self-management is assuming responsibility for your life and your actions through managing your lifestyle behaviours. On the last day in October of 1982, Tony Arvidsson, the author of this program, had a major heart attack. It was subsequently established that he'd also suffered a silent heart attack prior to this event. After hospital discharge, an angiogram revealed obstructions in 3 arteries. In consultation with the surgeon and cardiologist, Tony decided to pursue significant lifestyle changes instead of major surgery. Those changes included cessation of smoking, changes in eating habits and regular exercise. Tony's followed this regime for the past 24 years and continues to do so. Over this time, Tony has not experienced any further heart-related symptoms and he's been medication-free for many years. This self-management plan is a reflection of his action, and he's living proof of its success. Dr. Martin Strawn is a consultant physician and associate professor of medicine at the University of Queensland. He believes many of the diseases of modern man are self-inflicted. They occur as a result of behavioural patterns acquired early in life and often at an age when they're imposed by others, such as parents or teachers. Further, he considers many of these habitual behaviours were acquired decades ago, in an era when their detrimental effect was not understood. And indeed, some adverse behaviours were even encouraged or condoned by medical wisdom of the time. The behavioural patterns he refers to involve dietary habits, exercise activities, drug use, sleeping patterns, social relationships and belief structures. Behaviours involving these factors influence the development of cardiovascular, metabolic and malignant diseases. Medical science now has a better understanding of the importance of these lifestyle patterns and their influence upon disease. However, the difficulties still lie with motivating people to make lifestyle changes. Dr. Strawn believes the program, developed by Tony Arvidsson and adapted for Heart Support Australia, has the potential to significantly reduce the burden of disease in our communities. The program can achieve this by supplementing the medical model of diagnosing and treating disease by assisting people to make important lifestyle changes. Our behaviour and lifestyle is directly related to beliefs which are formed very early in life and become habits. These habits are very difficult to change unless they're identified. Once acknowledged, a reason, normally a powerful one, is required to effect behaviour change. A major life-changing experience, such as a severe illness, is often the catalyst. There's medical evidence to show that we have the capacity to heal sickness and reverse illness. To achieve this, we need to eat the right foods, exercise correctly and manage stress. If you only take 3 things away from this presentation, hopefully they'll be these: eat the right foods, exercise correctly, and manage your stress. For over 14 years, the American cardiologist Dr. Dean Ornish has been conducting a medical study called the Lifestyle Trial, which demonstrates that heart disease is reversible through lifestyle changes. This evidence is referenced in the Journal of the American Medical Association. Rehabilitation disease prevention programs also support these findings. The aim of self-management is good health and quality of life, and this is achieved by active participation. The objectives are to empower people through information, to encourage people to be responsible for their health, to develop a plan with options and strategies, and to develop the capacity to achieve your optimum health potential. At the moment, people are very reliant on the medical health professionals and healthcare system for their health. Many people believe that responsibility for and control of their health falls within the medical profession, and that they, the patient, are only the passive participant. I think you'll all agree that this is an unrealistic expectation. People should take responsibility for their own health, understand their ability to affect their health, and devise a plan that has the capacity for choice of optimum health potential. Risk factors are traits and lifestyle habits that increase the risk of heart disease. There are two types of risk factors: unmodifiable, those you can't do much about, and modifiable, those you can definitely do something about. Your age, family history and gender are examples of unmodifiable risk factors. Women who've gone through menopause also fit into this category. It's important to clarify family history. Find out why your mother, father or family member had a heart event. Was it because they were overweight, didn't exercise or had an unhealthy lifestyle, or was it genetic? Now we must look at the modifiable risk factors. These are the factors that we can change, such as smoking, being overweight, not eating correctly, high blood pressure, high cholesterol, lack of exercise, and high levels of stress. It's important to understand that heart disease is not a single risk factor disease. The more risk factors that you can eliminate, the lower the risk of having further events is multiplied. To assist in reducing our risk factors, we need to know the key principles of self-management. These include knowing your condition, assuming responsibility, and taking control of your health. You'll need to listen to and analyse medical advice and make informed decisions, and most importantly, negotiate a healthcare plan with your health professionals. Developing healthy lifestyle behaviours is as important as developing and practising good nutritional habits. Education, regular exercising and challenging adverse belief structures are all part of the key principles of self-management. In other words, it's time to take action. Education through cardiac rehabilitation is one of the first steps towards self-management. Cardiac rehabilitation covers exercise, nutrition, emotional and psychological support, along with medications, management and learning about your lifestyle behaviour changes. This self-management plan should be used in conjunction with cardiac rehabilitation programs in your area. However, some people are unable to attend cardiac rehabilitation programs for a variety of reasons. For those people, this self-management plan will prove to be invaluable. All people who've suffered a heart condition should consult a nutritionist to obtain reliable information on the best foods to eat to achieve your optimal level of health. Exercise and nutrition go hand in hand. You need to find a balance between what you're eating and how much exercise you do. If you eat more than you can burn with exercise, then you won't lose weight. In fact, you'll gain weight. This is why nutritionists and exercise physiologists are so very important, and so are your scales. If you don't have access to a nutritionist, there are other reliable sources such as the National Heart Foundation, Health Insight, the Department of Health and Ageing's website, and the state and territory departments of health. After a heart event, it's very important that you exercise regularly and develop a program suitable to your needs. Programs can be individually structured, taking into consideration any pre-existing condition and your level of fitness. Talk to health professionals such as exercise physiologists, physiotherapists, or your doctor to get advice on activities that are suitable for you. Don't forget, it's you who will have to do the activities. Many people don't have access to cardiac rehabilitation or exercise physiologists. Heart Support Australia runs walking programs at many of its branches Australia-wide. To find out if there's a walking program in your area, contact us at our website, heartsupport@heartnet.org.au. Many of us were brought up believing that it was cool to smoke, that alcohol was good for you, that we should eat everything on our plates, whether we're hungry or not, and that we should work as hard as we can. If you get stressed, deal with it. Those of us who lived like this are now starting to pay the price. Heart disease. We need to change the way we think. We need to challenge these adverse belief structures. We now know better. So it's important to take action and take responsibility for your actions. The medical profession can't do it for you. If you don't change those bad habits, you're more likely to be readmitted to hospital. Take action, take control, and make it happen. What we'd like you to do now is to be really honest with yourself and ask yourself these questions. Who's responsible for my illness? Which lifestyle factors have caused my illness? Can my current health be improved? What needs to be done? Am I prepared to make the changes? Who can affect my health the most? Maybe here is the perfect opportunity to tell you that 70% of hospital admissions are lifestyle related. Support groups can assist you by providing information, encouragement and support to you and your family. They have the been there, done that factor that can be of great assistance because you can relate to them and see that there is life after a heart event. The most important person to you as an advisor would be your partner, your husband or your wife, because they know you best. Family in general are also important. Other important advisors are your doctor, your cardiac coordinator and other health professionals. If your medical practitioner and/or health professional is aware that you're taking affirmative action with your health, you'll receive greater cooperation and assistance. Have the heart and make the change. It's up to you. Body signals are non-verbal communication signals, the way your body speaks to you. Are you feeling slightly nauseous? And has it been a while since you last ate? Your body's telling you it's hungry. Are you constantly yawning? Your body's telling you it's tired or isn't getting enough oxygen. Are you shivering? Your body's telling you it's cold and is trying to warm itself up. Are you in pain? Your body is telling you that something's wrong. If your body gives you warning signals that you're doing too much, then it's important to listen to it. If something feels too hard, then it may be that you need to slow down. Build your body and increase your fitness gradually. Ignoring body signals is at best risky, at worst potentially deadly. For example, many people have died because they ignored pains in their chest. Let's look at how we can affect change. We need to firstly identify the problem, for example, a heart attack. Then we need to identify changes, such as the need to change eating habits, exercise, and reduce stress levels. Having done this, we can then establish the benefits of that change. Benefits such as improved health and ultimately survival. At this point, we should seek advice and collect accurate information regarding the changes we need to make. Announcing the decision is important because you're more likely to continue for fear of failure in the eyes of your peers. Therefore, it assists you to follow through on that decision. It's important to take responsibility to ensure that you exercise. Develop an action plan and set measurable goals. You'll need to start moderately and increase as fitness improves. You need to seek guidance for appropriate levels. The importance of setting measurable goals is that you'll be able to determine the results of your actions and how successful or unsuccessful you've been. And then you'll be able to modify your goals accordingly. It's important to deal with obstacles and setbacks and not let them stop you from continuing. Look at what changes need to be made and measure the results. Ask yourself, am I walking further, faster, longer with no more exertion? Acknowledging and rewarding yourself for your achievements is critical, but so is setting new goals once you've reached the previous ones. Now let's look at an example. A 60-year-old man's admitted to hospital with severe chest pains. Tests reveal the patient has suffered from a heart attack. 5 days later, the man's released from hospital without suffering further events. The hospital medical staff refers the patients to his GP, who confirms that the man has 3 major risk factors: smoking, high blood pressure, and elevated lipids or cholesterol. His doctor has prescribed medication for his condition and counseled the man to make appropriate lifestyle changes to reduce the risk of another event. The man's ignored that advice and relied on the medication for prevention. The man's overweight and doesn't exercise because he believes he spends enough time in his garden. He considers this is a good replacement for exercise. He thinks he's a moderate drinker and has told the GP that he only drinks a couple a day. In fact, He drinks 6 standard drinks most days and more on special occasions. To add to that, he feels stressed, but won't admit this, and has not shared this with his doctor. His stress stems from ongoing disagreements and intense dislike of his neighbour, which is mutual. His GP, although unaware of all matters relating to this man, informs him that he'd like to refer him to a cardiologist for possible tests. The man agrees to this and the appointment is made. At this appointment, the cardiologist obtains a history of the patient and notes that he has 2 older brothers who have also suffered from heart disease. He wonders whether they have a common genetic predisposition to heart disease or whether they simply all sat at the same table while they were growing up. He then performs a clinical examination which reveals that the man's blood pressure has considerably lowered following his heart attack. It was also noted that he's obese, adding to his collection of already identified risk factors for cardiac disease. The cardiologist then orders an echocardiogram and an exercise stress test, followed by a coronary angiography. These tests find him at risk of a further heart attack, and he's treated by balloon dilation and stenting, thus eliminating this immediate risk. This means that although the man now has a lower risk of further heart attack in the near future, his risk of continued progression of atherosclerosis, which is a build-up of fatty deposits within the arterial walls, is high, and so he's referred for cardiac rehabilitation. He must now take medication, including blood thinners and a lipid-lowering agent. He's on a beta blocker for at least 12 months, and he's also been advised to use an ACE inhibitor medication to assist in remodeling of the left ventricle. The ACE inhibitor and beta blocker also provide some assistance in blood pressure control. Some of these medications may be able to be reduced or discontinued if good progress is made with risk factor reduction. And that's what this plan is about. Using this gentleman as an example, we can now explain this plan as we go. The first step to reducing risk factors is the assessment stage. At this stage, we work out the problem. For this gentleman, the problem was a heart attack. Then we look at what caused the problem, or the heart attack. In this case, it was his unhealthy lifestyle. The fact that he didn't exercise, was overweight, was a pretty big drinker, and was fairly stressed. Then we look at what he needs to do, such as finding information on lifestyle changes, diet, exercise, medication, that sort of thing. Then lastly, he needs to work out his reason for wanting to do this. For many people, it's simply the fear of dying. Next is stage 2 of the plan, the planning stage. This is where he works out what he actually needs to do. First, a suitable plan needs to be developed in conjunction with the doctor and the cardiac rehabilitation coordinator. It's important in developing this plan that manageable goals are set. Don't set them too high. For example, reducing his cholesterol levels could be a manageable goal, a goal that can be reached. Once he's set this goal, then a time frame is needed to achieve it. So, for example, set a time frame of 3 months. He wants to reduce his cholesterol within the next 3 months. Step 3 is the implementation stage of the plan, and this is where action is taken. He's already worked out what the problem is and what he needs to do to reduce the risk of the problem reoccurring. Now he needs to actually do it. Therefore, if he wants to reduce his cholesterol, he'll need to attend cardiac rehabilitation, start exercising, and change his eating habits. This is the first step of the implementation stage. The second is to understand and be aware of obstacles that may occur and overcome them as they arise. The most common obstacle, of course, is the individual themselves. Most people are reluctant to change and are their own worst enemy. It's very important to remember why he's changing. The final step in the implementation stage is the testing. He needs to test to make sure that the action is working. Some tests are easy and can be done by him, such as weighing himself to see if he's lost any weight. Other tests are done by his GP, such as testing to see if cholesterol levels have dropped. Finally, it's time to evaluate the plan. Evaluation is important to ensure that what he's doing is actually working. We start with measuring. Is his weight correct? Has his aerobic capacity increased? Are his lipid levels correct? And have symptoms disappeared? By following this plan, there should be visible improvement. If so, then he can reset his goals. He's reached the desired outcomes and now can reset new goals that are better suited to his current state of health. We're now going to give you an example of a plan. Remember, though, You need to develop a plan that is your plan, a plan suitable for you. This is just an example to give you an idea of what we've been talking about. Exercise 1 hour a day, 6 days a week. Stop smoking. Reduce or eliminate fat. No added sugar and salt. Reduce intake of packaged and refined foods. Limit alcohol intake to 1 to 2 standard drinks per day or less. Eliminate fast foods. Spend 30 minutes per day relaxing. Use lower half of BMI, that's body mass index, as a marker. Remember, the road to health is right in front of you. You'll have your ups and downs along the way, but if you develop a plan that'll suit you, you'll be up more than you're down. If you do find yourself feeling down or depressed, there are things you can do. If you're feeling down, take time out to talk to someone, a friend, a family member, a support group, or even your family doctor. Do something that makes you feel good. See a movie, read a book, or meditate, or have a nap. You may just be tired. If you're still feeling down and feel that you're suffering depression, please see your doctor. Depression is a very common effect after suffering a heart attack. If it's ongoing, you do need to seek professional assistance. Your GP would be the person for you to talk to in the first instance. They'll be able to ascertain whether to refer you on for further assistance. There's no shame in feeling depressed. There is shame in not doing anything about it. If you'd like any further information or assistance in developing a self-management plan suitable for you, you can contact the following organisations: Heart Support Australia in your local area, your local cardiac rehabilitation unit, the Health Insight at the Department of Health and Ageing website, or your local doctor or hospital. We wish you a good and happy journey on your road to good health.